Hello everyone, Assalamu alaikum. This is Dr. Mubasshra and today I want to talk about how to prepare for MRCP PACES in 3 months. PACES is the last hurdle in MRCP race. It is the final step before you get your prestigious MRCP qualification. In this video, I am going to share top tips that how to prepare for MRCP PACES. Understand the rules of the game. Know your exam and know your enemy. Understanding your exam and know what the examiners want from you is very important in order to pass any clinical medicine exam. PACES is divided into total 8 encounters or 5 stations. Time management, fluent presentation, and identifying physical signs are very important in PACES. Familiarize yourself with the exam, sequence and steps by practicing so that you are able to complete the examination in the given time. So practice all 4 stations, all 5 stations with timer. Start by examining the normal patients, for example, your friends or family, so that on the exam day it feels like you have good practice of examination and it seems like a second nature to you. And you don't have to think for the next step of examination because there is not enough time. And you have to identify the physical signs and correlate them in order to formulate the differential diagnosis. Another important tip for long clinical consultation is that write down the pattern of history and the important differential diagnosis of your presenting complaint before going into the station of long clinical consultation. It will help you to narrow down your differential diagnosis in the exam. The famous saying, time is not the main thing, it is the only thing. I wanted to share certain tips with you people. Tip number 1, start your preparation by watching online or offline PACES videos, either past test PACES videos or free videos available on the YouTube. This is the thing which you will do in your first month of preparation. Tip number 2, follow the correct sequence of examination because this is very important thing. Tip number 3, find a study partner and practice, practice, and practice. Even you can make a group of more than 2 doctors because practice is the backbone of your PACES preparation. And practice all of the stations, even clinical short cases as well as communication and long clinical consultation. And you can practice in front of the mirror. I mean the presentation part. Tip number 4, always practice with a timer and try to finish your examination in the given time because time management is very important. Tip number 5, find the right PACES course before at least 1 month of your examination and the course will help you to tune your mistakes. And tip number 6, book selection. Avoid reading big books, and this is the advice which I want to give you according to my personal experience. I have made a separate video about books recommended for MRCP PACES, and it will help you that which book is best for you. Work on the most important things first. There are 7 skills which you need to pass individually in your MRCP PACES exam. Physical examination, identifying physical signs, history taking or clinical communication, differential diagnosis, clinical judgment, managing concern, and maintaining patient welfare. Presentation skill is very important in PACES exam or any clinical medicine exam. And it is very important to organize your thoughts and present in a slick and fluent manner. And it will enhance your confidence in the exam. There is not a lot of time for the viva in the exam, so if you spend too much time in your presentation of the case, the examiner will not have time to ask from you the viva questions like differential diagnosis, investigations, and treatment plan, which means the examiner will not be able to score you in terms of clinical judgment, and ultimately you won't be able to score high marks in that station. The main tip to improve your presentation skill is to write down important key points of important cases during your preparation and keep on presenting those according to your case. Some candidates during their presentation prefer saying the diagnosis first before describing all the positive clinical findings, whereas other candidates prefer to summarize your findings in a systematic way, starting from the peripheral signs and then your targeted system. And after that, they come up with a differential diagnosis. Both ways are okay and they really don't matter much. However, the first method is preferred only if you are 100% sure of your diagnosis. But in order to play safe, the second method is preferred. That is, tell your positive physical findings first and then tell important differential diagnosis relevant to the case. So, learn how to present properly. And again, the same thing, that study smart, no need of big books, because mostly the patients which come in the exam, they are stable patients. And for example, those with chronic disease like diabetes, thyroid, autoimmune disease, and Parkinson disease patients. And another important thing is that don't waste too much time on the big books, because you don't need to remember each and everything in the MRCP PACES exam, which is written in the medicine books. Only the important salient points are more than enough, because there is not much time to study and not much theory that is required for in order to pass the exam. The famous saying, your positive action combined with positive thinking results in success. And productivity is never an accident, it is always the result of a commitment to excellence, intelligent planning, and focused effort. That's all for today. If you have enjoyed this video, please give it a like and subscribe to my channel. And I will see you soon, inshallah, with another video. Thank you.